thinking of a good clinic, they would provide a documented report of embryology. A lot of clinics don't give this, in the sense that I get so many patients who don't have any idea of how many embryos they had in their previous cycle, what was transferred, was it a day 3 embryo, was it a day 5 embryo? They have no clue. And that's where we as IVF clinicians also suffer, in the sense that we are losing out on so much information from the previous cycle, so we don't even know how to optimize it. And that's one very important thing that patients should consider, that whatever's happening, you should be getting a documented report for your embryos and for your cycle as well. Now, as far as technology is concerned, time lapse is one technology where it's actually a specialized incubator. So it's like the embryoscope that we have in the clinic, where you actually have cameras attached to the incubator which will record the whole development of the embryos. So right from day 0 to day 5, you can actually see the embryo divide from one cell to two cell, two cell to four, four to eight, then into a
Wow.
morula, then into a blastocyst. Yeah, it's actually very, very fascinating. Pranay also has this. And in the sense that any small minute issue with the embryonic development, like let's say it's going from 2 cell to 5 cell directly, that's a problem for me. I don't like such a developmental error. Or it's going from 5 cell to 4 cell and then go dividing again. So these are all small issues which you would not be able to visualize in normal morphological assessment. So that's a technology that can help patients to actually choose and deselect embryos. Another thing that's coming up nowadays is artificial intelligence. So you can actually you take a snapshot of the blastocyst, which is a day 5 embryo, which is the last stage of the embryonic development. Let the artificial intelligence software decide or grade the embryo, and it actually has a more precise grading system, or a selection system can actually help you in optimizing your results. Especially now, if it's a case where you don't have access to embryologists, or you don't have access to senior embryologists, maybe this is a software which can actually help you in selecting the best embryo and thus optimizing your results. You also have things like embryo biopsy and PGT which can be done, but obviously most clinics will not be able to offer this. Only high tertiary level clinics would have access to all of these facilities, and these are questions that patients need to ask their clinics. Obviously, not all patients are recommended for these technologies, because you might be a normal responder, you might be a young, good prognosis patient, and you'll just conceive with a regular cycle. But patients who've had a lot of failures, or have had like severe male factor, or have had like poor embryonic development in their previous cycles, they might be the ones where like adding on such a technology might help them.
Don't forget to like, subscribe, and hit the notification bell for more amazing videos on fertility. And to get your customized fertility coach program, visit www.fertilitydost.com.